Please be seated. I heard an applause. You can put your hands together for the Ghana National Anthem. Usually when this is played, it means we are ready to give Nigeria a good whipping in football. But because Baba is here, we will behave. Would like to first acknowledge the host and president of the Republic of Ghana, Excellency John Dramani Mahama. Welcome, sir. Please put your hands together for the president. We are privileged to have the former president of the Federal Republic of Nigeria, Excellency Olusegun Obasanjo, here with us. Thank you, sir. We are so grateful to have the former president of Liberia, Her Excellency Ellen Johnson Sirleaf, here with us. Thank you, ma'am. Extremely happy to have the former president of the Republic of Mauritius, Excellency Amina Gurib Fakim, also here with us. It's also a distinct honor to have the DG of the WHO, Dr. Tedros Ghebreyesus, here with us in Ghana. We have a whole raft of health ministers here. We would acknowledge all of them, but just for the purpose of protocol, I'd like to acknowledge, of course, the Minister of Health for Ghana, the host country, the Honorable Kobna Minta Akando. And of course, our cousin, the Honorable Professor Mohammed Ali Pat, Coordinating Minister of Health and Social Welfare for Nigeria. You are officially welcome to the Accra Health Sovereignty Summit, dubbed the Accra Initiative, happening today in the capital of Ghana, which is the gateway to Africa. When we say that, usually some people say Ghana is the gateway, we are the final destination. But there are three key words for today's program. We are here to reimagine healthcare, to co-create solutions for our future, and to insist on health sovereignty. This program comprises three parts, where we would have the official launch, which is where we are at. We would also have deliberate high-level dialogues, reflections, and collective action planning. And in the spirit of co-creation, even though I am the MC for the first part, I have a co-moderator in the person of the excellent Dr. Magda Robalo, who is a global health expert and the former Minister of Health for Guinea-Bissau. Let's acknowledge her with a round of applause. She will lead us through the heavy lifting. We'd like to make two quick announcements that for the exigency of the moment, this is a very different summit. There will be no coffee or cocoa breaks, but there is a lot of cocoa drinks in the lobby. We want to make the best use of time, and therefore you can go out and get drinks as and when you need it. The second announcement is that this program is being simultaneously cast in French, Portuguese, and English, and we've assisted with those facilities next to you so you can hear the language that best suits you. We'd like to set the scene by bringing upstage the newly appointed. He's new because although he's been in Parliament for 12 years and he's been a ranking member of health for 7, he's been a Minister of Health for less than a year. His Excellency asked him to put his money where his mouth is, because as ranking member, he was doing a lot of advocacy in opposition. So now his job is to perform, to deliver quality health care to the people of Ghana. Ladies and gentlemen, help me welcome the Minister of Health for Ghana, the Honorable Kobna Minta Akando, to set the scene for the Africa Health Sovereignty Summit.
Thank you, Bernard. Your Excellency President John Dramani Mahama, the President of the Republic of Ghana, Your Excellencies President Obasanjo, Your Excellency Johnson Sirleaf, Your Excellency Amina Gurib Fakim, the Director General WHO, Dr. Tedros, distinguished ministers, partners, friends of Africa. On behalf of government and the people of Ghana, I warmly welcome you all to Accra. We gather today at a moment of both extraordinary urgency and possibility. Ladies and gentlemen, I see before me the faces of those who bear the heaviest responsibility in the modern Africa state to protect life. This summit is not about repeating old resolutions and polishing familiar declarations. It is about reimagining a future where Africa owns its health, where the well-being of our people depends not on goodwill from afar, but on wisdom, solidarity, and investment from within. As you might have realized, we no longer speak of compact, a fist-closed agreement. Now we speak of an initiative, a living, evolving commitment that breathes and dares, inviting us to work together step by step, uttering our own story and shaping the future on our own terms. Your Excellencies, distinguished guests, the shift reflects clear feedback we received from governments, partners, and communities across the continent that called for a more flexible, inclusive, and dynamic approach to healthcare sovereignty. What do we mean by health sovereignty? We do not mean isolation. We mean the power to make binding decisions, to deploy our own resources, and to lead the systems that determine whether our people live or die. For too long, Africa has been spoken to rather than to listen to. Our health budgets and policies were shaped more by donor ceilings than by public need. Much of this architecture was designed in crisis, and crisis often freezes systems that should evolve. As an African proverb teaches us, he who has health has hope, and he who has hope has everything. Health is a precondition for every liberty we cherish: education, employment, equity, even peace. A dependent health system cannot defend itself, and a sick nation cannot develop. This is why we must shift the paradigm. Health should not be an afterthought. It should not be funded by charity after other more important sectors are handled. As Dr. Ngozi Okonjo-Iweala rightly said, health is development itself. Ladies and gentlemen, in Ghana, we have walked this path with resolve. Our national health insurance scheme, our community-based CHIPS compound, and investment in local pharmaceutical production are not perfect, but they declare a powerful truth: African problems demand African solutions. Let us recall Africa's leadership in global health. From Ama Ata primary healthcare vision to Abuja's commitment for at least 15% of national budget for health, and more recently, the Lusaka agenda. The question now is, how have we kept this promise? And if not, what holds us back? Dear leaders, sovereignty begins with honesty, the courage to measure ourselves against our own standards. Ladies and gentlemen, health sovereignty does not mean rejecting partnership. It means demanding mutual respect and equal footing. We present not only in the waiting room, but in the operating theater, designing, leading, and owning our health future. It means investing in strong data systems so our realities are truly reflected. It means supply chain sovereignty. Above all, it means a political courage to fund health even when the budget is tight. This is what we mean to do, because when health is financed wisely, it always pays for itself in increased productivity, stability, and improved quality of life. Let us remind ourselves that this summit is not a mere meeting. It is a living initiative. We have a space for shared learning, open challenge, and collective ambition. It's a historical opportunity to co-create and shape the architecture of our health governance. We have the knowledge, the experience, and the wisdom in this room. Our challenge is the courage to act together. As I close, I return to the proverb that guides us. He who has health has hope, and he who has hope has everything. Let us give our continent everything it needs to hope again. We must close not with declarations, but with fierce, actionable commitments that ensure our dignity no longer depend on the generosity of others. Let us build a future where our investment, innovation, integrity secure the well-being of our children. Ladies and gentlemen, the task is immense but not impossible, because the most radical act in global health today is simple: to believe that Africa deserves better and to build accordingly. May we rise to the responsibility history has placed on us. I'm grateful for the opportunity.
Thank you very much, Honorable Minister of Health, Kwabena Minta Akando. To have health is to have hope. Let's put our hands together one more time for that rousing clarion call for the sovereignty of Africa's health. We'd like to bring her now to speak to us. She started as a human rights advocate. She later became the Minister of Gender, Children and Social Protection for Ghana. Now she's the Deputy Chief of Staff. Ladies and gentlemen, please help me receive Nana Oyebampo Addo, to build on the foundation so eloquently laid by the Minister of Health. Thank you.
Your Excellency, the President of the Republic of Ghana, John Dramani Mahama, Excellency, the Director General of the WHO, Excellencies, former Presidents of Mauritius, Nigeria, and Liberia, Honorable Ministers, distinguished guests, ladies and gentlemen, once again, on behalf of His Excellency John Dramani Mahama, President of the Republic of Ghana, the people of Ghana warmly welcome you all to Akwaba. Following on from the remarks of our Honorable Minister of Health, Honorable Akando, allow me to frame this summit in the appropriate context and focus on the outcomes that bring us together today. Your Excellencies, ladies and gentlemen, we converge in Accra at a critical moment for global health. Our hard-won gains are at risk, from maternal and child health to HIV and pandemic responses. Additionally, shifting geopolitics and reduced donor funding are testing the resilience of our systems. The global health governance architecture, built in a different era, no longer reflects Africa's realities of this time. It is no longer fit for purpose. This high-level summit is our response. It is a call to reimagine health governance through African leadership and continental sovereignty. This summit is not a ceremonial meeting. It is a working co-creation. Lay the foundation for a presidential task force to design a time-bound, actionable framework for reforming global health governance in line with our national and continental priorities. We are also seeking to reflect on the changing global health landscape and its impact on Africa, both the risks and opportunities before us. We also seek to co-create bold, sovereign solutions that will influence a reimagined global health governance architecture with Africa as its center. We will endorse a sustained framework. This will be our vehicle for safeguarding health gains, driving country-led reforms, and preparing our systems for the future. We will define a clear roadmap beyond Accra, ensuring that the solutions we design here are socialized and adopted through key African and global milestones. From the African Union summits to the United Nations General Assembly and other global health fora, so that our collective voice is heard and acted upon. These outcomes are not just words on paper. They are the roadmap for delivery, from Rome to national capitals, and from our continent to the global stage. This summit is also a signal to the world that Africa is no longer a passive participant in global health governance, that we are authors of the reforms we need. We are investors on our own systems, and we are partners to the world on equal terms. By working together today, we are launching an Africa-led initiative that can reshape not only our continental approach, but also the global health order. We are going to make it more inclusive, more resilient, and more reflective of today's realities. So this is a call to action. Excellencies, ladies and gentlemen, on behalf of His Excellency President John Dramani Mahama, I thank you all for joining us and for your commitment to building a new era of health sovereignty. Let us leave Accra with bold outcomes, actionable next steps, and a shared determination to protect the health, sovereignty, and dignity of our people. And let us carry this work forward to every milestone, from every AU meeting and also the United Nations. Let's carry this forward until these solutions are fully embraced and fully implemented. Thank you.
Oh, come on, I think she deserves a better round of applause than that. Thank you, Nana Oye Litha, for reminding us that what happens in Accra will not stay in Accra. It will reverberate across the globe, to the extent that partners from all over the world would solidarize with us in this noble journey towards health sovereignty. Let's applaud her one more time. Thank you so much. In the spirit of partnership and collaboration, we'd like to now hear from an important global leader and a champion of health sovereignty in the world. He is the former Prime Minister of the United Kingdom. The Right Honorable Gordon Brown will join us by video link. Please pay attention to the screen.
I want to express profound gratitude to His Excellency President Mahama and all African heads of state and government who are convening this important Health Africa Sovereignty Summit to formulate the Accra Compact. And while I can't be with you in person and I'm with you only online, I feel very close to your ambitions and ideals and want to support your initiatives in any way I can to progress this new, innovative and very exciting health agenda. You know, while the old order of solidarity and multilateralism has achieved much in reducing infant and maternal mortality, vaccinating millions of children, attacking polio, TB, malaria, HIV, AIDS, and many diseases, all the pillars on which this world order was built are crumbling. We're moving from a unipolar world to a multipolar one, to one which has got to recognize, as I've argued for years, the rising aspirations of the global south in all our international institutions, and to an order where, despite growing protectionism, global problems from climate change and financial contagion to inequality and pandemics that need global solutions require us to cooperate more closely together as partners. So we need a new world order that meets the ambitions of the South, engages all parts of the world as partners, and ensures a sustainable, vibrant, secure and prosperous future. And as in the past, health can serve as the cutting edge of the transformation required. But you know too, we're also at a point of crisis, with a steady 40% reduction in ODA over the past 5 years, now combined with a rapid acceleration in decline over the past 8 months. Global health as we once knew it is no more. I believe that even out of this setback, however, we can shape a better, more healthy future. Because I agree with the leaders from low and middle income countries who are now speaking out, not just against the reduction in promised provision of aid, but against the very system of dependency that failed in the end to deliver sustainable domestic health systems of the kind we need. And they are calling for us, as I call for us, to reimagine the future of global health, to build a new architecture informed by country-led and regionally led transition plans, to move from aid dependency to independent, locally linked development. And such architecture, as you have said, needs to draw on pioneering models of country-led transitions away from external health ownership and financing and towards self-reliance through capacity building. And that will take into account the need for local ownership of data, and will take into account new forces like the risk of displacement and illness because of the effect of climate change. Crucially, this new model would shift the emphasis of health policy from outsiders managing the delivery of services and driving policy to local providers running them, giving precedence to what should have always been the case, the local delivery of local solutions, health run by the people for the people, the outcomes dictated by people on the ground. Now, I know that this important transition, which you are pushing forward with in your proceedings today, will also require increased funding. In each of your countries, you will chart your own course, but I will stress to my counterparts in the North that we have a responsibility to help fund this transition. And here there is great potential from innovative approaches, such as guarantees provided by high-income countries. But as you know as well, there are taxes locally. On tobaccos, we tax tobacco at 80% in the United Kingdom. Alcohol, we tax at 70%, as well as taxes on sugary beverages, with the dual benefit of raising revenue while curbing use of products harmful to health and costly for health budgets. So you who are assembled in Accra can be the leaders of this transformation, supporting countries to successfully transition from external dependence to a new engagement founded in full country ownership and leadership, with new partnerships to support a holistic, all of government, all of society approach to development, and to embrace this new compact, the Accra Compact, to create a better future for all of us. I applaud President Mahama's and the other African leaders who are grasping the mantle and working to drive global change. I assure you of my strong support and commitment to persuade others in this continent to be part of the worldwide movement you have begun today, and to do so in whatever ways we can to back your efforts. My best wishes in everything you do.
We thank the Right Honourable Gordon Brown for recognizing Africa's central role in the future of global health. We now like to bring up a man we're very proud of here in Ghana, because we saw how ably he led the world during the dark days of COVID-19. And from those days, he hasn't looked back. We're very proud to have Dr. Tedros Ghebreyesus, who is the DG for the World Health Organization, to bring us his remarks at the 2025 Accra Health Sovereignty Summit. Please welcome Dr. Ghebreyesus with a resounding round of applause. Thank you.
Thank you, moderator. Your Excellency, President Mahama, Excellencies, former President Obasanjo, my good friend, former President Sirleaf, former President Amina, Excellencies, dear colleagues and friends, thank you for the opportunity to join you today. And my thanks to President Mahama for his leadership in convening us to chart a new course for the health financing and governance on our continent. The summit builds on the leadership of President Kagame and the work of the Africa Union to strengthen the reliance of African nations on their own resources to finance the health of their own people. And it goes a step further, acknowledging that finance alone will not take us to the aspirations of the Lusaka agenda for country-owned, investment-oriented, sustainable health systems. We must address the deficient global health architecture. As you all know, sudden and steep cuts to aid are now causing the most severe disruptions to health systems since the peak of the COVID-19 pandemic. According to WHO's latest analysis, health aid is projected to decline by up to 40% this year compared to just 2 years ago. This is not a gradual shift, it's a cliff edge. Life-saving medicines are sitting in warehouses, health workers are losing jobs, clinics are closing, and millions are missing care. We must all adjust to this new reality. But in this crisis lies an opportunity to shake off the yoke of aid dependency and embrace a new era of sovereignty, self-reliance, and solidarity. Many African leaders have told me they're ready to make that transition, as President Mahama is demonstrating. And that's the critical first step: political commitment from the highest levels. The responsibility for financing strong, resilient health systems rests with governments. The most efficient and equitable source of health financing is the national budget. Ghana is leading by example. Earlier this year, the Parliament passed reforms to increase financing for the National Health Insurance Scheme, filling the gap left by donor withdrawal and delivering on the President Mahama's bold commitment to free primary health care for all. That's what sovereignty looks like. And thank you, Mr. President. Of course, private capital and philanthropic capital are both very important, but they can only complement public financing and they cannot replace it. And more money alone is not enough. What's important is how effectively that money is used. WHO's work with countries has shown that up to 13% of health budgets in low and middle-income countries go unspent due to weak public financial system. That is money lost. But more importantly, it means lives lost. WHO is now working with governments and partners here in Africa and elsewhere to strengthen value for money in several ways. By developing essential health benefit packages and cost-effective policies, by supporting countries to introduce or increase health taxes on tobacco, alcohol, and sugary drinks, through pool procurement and investment in domestic manufacturing, by integrating donor-funded vertical programs into government-led systems based on primary health care, and through public health insurance, and through better budget execution using digital public health financial management system. We must also confront the structural constraints. Debt service burdens are crowding out social investments, and donor funding often bypasses national systems, making long-term planning almost impossible. We cannot ignore the broader economic context. In 2023, Africa received $74 billion in aid, but lost $90 billion to illicit financial flows and $55 billion to corporate tax exemptions. So Africa lost much more than it gained from aid. And this is unacceptable. One practical solution is health taxes. A 50% price increase on harmful products like tobacco, alcohol, and sugary drinks could generate an additional $3.7 trillion globally within 5 years and save millions of lives. Beyond domestic reforms, global change is essential. WHO is using its presence on global fora, from the G20 to the European Commission, the severe financing for development to the UN and the BRICS group, to call for a more democratic, fairer, and accountable global health architecture. In May, the World Health Assembly adopted a landmark resolution led by Nigeria, my brother here, Mohammed Pate, and co-sponsored by over 25 countries, including Ghana, South Africa, Senegal, and Zambia, calling for more domestic investment and deeper governance reform. It reflects the Lusaka agenda and the principles of one plan, one budget, one report. WHO's mandate is to support governments in building strong, resilient, inclusive health systems, guided by evidence and grounded in equity. Let me be clear. Africa does not need charity. Africa needs fair terms. As President Nkrumah said over 60 years ago, I quote, "We are not interested in handouts. We seek a new international order in which health and development are global rights, not privileges for the few." This is not a dream. It is a choice. The difference between crisis and opportunity is leadership. We need leadership from governments to invest in their people and their health. We need leadership from creditors to offer concessional lending at fair terms. We need leadership from donors to strengthen national health systems, not create parallel ones. Ultimately, health is not a cost to be contained. It's an investment to be nurtured in people, in stability, and in prosperity. And the leadership by President Mahama now to address these issues is very timely. Thank you, Your Excellency, and let's seize this moment not just to repair, but to transform. Thank you. Medasi.
So the response to Medasi is Enasi. And as you channeled your inner Kwame Nkrumah, we remember the red, gold, and green of Ethiopia, which inspires us here in Ghana. Thank you, Dr. Tedros, for telling us that health is not a cost to be contained, but an investment to be nurtured in people, institutions, and stability. Let's acknowledge him one more time. We're still here at the Accra Health Sovereignty Summit with our 3 watchwords. We're co-creating, we're reimagining health sovereignty. And it is with distinct pleasure now that we welcome a man who needs no introduction. I'd like to invite us to rise and welcome the former President of the Federal Republic of Nigeria, His Excellency Olusegun Obasanjo, to bring us his fatherly remarks on this auspicious day for health sovereignty on the African continent. Please keep clapping as we welcome our father. Thank you, sir.
Please be seated. President Mahama, thank you very much for laying this on. My dear sister, President Johnson Sirleaf, thank you for making it here and giving encouragement to our brother. President Amina, thank you also for being here. Tedros, I won't say president, but you never know. Thank you for being here. When we have a problem and the world health situation today is problematic, I believe it is the responsibility of leaders not to just wring their hands, but to stand up and do something about it. And President Mahama, that is what you are doing. President Mahama, that is what you are doing. I will also want to thank President Kagame, who has been spearheading African health, financing, architecture, and infrastructure. I want to thank Prime Minister Gordon Brown for giving support and going along with us on this journey. It's not going to be an easy journey, but it's a journey, if I may say, that has precedent. We have been in very critical health situation in the past. We had Ebola. We had HIV/AIDS pandemic. We had COVID-19 pandemic. But we rode out of all this. And the way we handled HIV/AIDS in particular should give us something to cheer about, something to give us hope, and something that can lead us to where we need to go in the fractured global health situation that we are in now. I don't believe that I need to belabor the situation that we are in, but I believe what we need is solution. How do we move from the present to the future, immediate future, of hope, of confidence, and of health security for all? Let me start at the family level, family and community level. I believe that we need to do more with traditional medicine. I was in a meeting not too long ago, about, 15 years ago. And the meeting was about afforestation. And when I got there, the people I started seeing were people in pharmaceutical. So I thought I was in the wrong place. When I went to them, I said, look, we are here for afforestation. Why are you here? And they said they were in for afforestation too. And they told me and said, 80% of the drugs we buy in the pharmacies have their origin in herbs. And what is happening is that these trees are being cut, they are being destroyed, and they have not extracted enough from the herbs. I learned a lesson from there. So the herbs that we have in our villages and rural areas are useful. And even the pharmaceuticals of the world have 80% of what they sell to us having their origin from herbs. At the family and community level, we can use more herbs than we are using traditional medicine. At the national level, I believe that there's virtually no country in Africa today that doesn't have health insurance in one form or the other. We can expand and enhance health insurance. And 25% of our health insurance fund can be used to manage our health architecture and go into health infrastructure. At the continental level, just as we have now risen to have a peace fund, and I tell you what that peace fund has started to do. When I was appointed Special Envoy for the Horn of Africa, and I was handling the situation in Ethiopia, AU was waiting for European money before I could start, or American money. Today, 5 of us have been appointed as facilitator for DRC and Rwanda. Immediately, AU made available $1 million out of peace fund. That is progress. I believe we can have a health fund for Africa. And this health fund can be managed by Africa Development Bank. And the source, to start with, something like $100 for flying into Africa or flying out of Africa, but not for traveling within Africa. And then, of course, we can see what else we can do to enhance that fund. But we need health fund for Africa. Global, I believe at the global level, we should have health security for all. Health security for all. Here in this country, some time ago, the slogan was Ghana Beyond Aid. I believe the slogan for us should be now Africa Health Without Aid. But with global partnership, solidarity, cooperation, and collaboration, and of course, togetherness. Because pandemic, as we have seen, knows no geographical boundary, knows no borders. We have to work separately and together for security for all, health security for all. Thank you.
Thank you, Your Excellency Olusegun Obasanjo. Let's put our hands together one more time for His Excellency. Thank you so much. From Ghana Without Aid to African Health Without Aid. Please be seated. This is still the Africa Health Sovereignty Summit coming to you from Accra, Ghana. We have heard from the doyen of Nigerian politics, Excellency Olusegun Obasanjo. We will be bringing up shortly our host and special guest. But before we do this, as has been alluded to by other speakers, this man is very committed to healthcare to the extent that he has put his name under a very important initiative of his. We went to the streets of the country to find out the expectations around that very important initiative and their hopes around that program. So before we bring up His Excellency, we would like to show you a short video documentary of what ordinary Ghanaians are saying about the expectations of the Mahama Cares program. Please pay attention to the screens.
Mahama Care is about taking the hospital to the people in such a way that when you go to the rural areas, they find it difficult getting to hospital. So Mahama Care is a good policy that I think all Ghanaians can benefit from it.
Well, I have fairly heard about the Mahama Cares, and I know it's government's efforts in supporting the healthcare industry in Ghana. I've been to the Trust Hospital, and that's where I usually go for my healthcare. The service was great. I see that they've really renovated the place. Everything was pretty smooth in terms of the infrastructure, in terms of the systems, and I didn't really waste time there at all.
So at the moment, my grandmom is at the Ridge Hospital, and she's been on admission since last week. And I think that if government invests more in that, it's a good thing, because you are coming to get well, not to take something back home.
The Ridge Hospital, I've been hearing, but I haven't been here. This is my first time. I think I came here 4 days ago, and I can say that the nurses and the doctors, like the attentive, they are very good. They took very care of my mom. When she came, the high pressure, she was very bad. but they very took care of her, and I can say they did very well. What I came to see here, I was very impressive. The government, the nurses, the doctors, they are very good. So for my advice, he can put on, because he's helping the citizens. Okay, he's helping us too. So I'm just saying that he should also do more and do more about the healthcare.
More investment in the health center is going to help us, because some people are in emergency. If you have more hospitals, I don't think even our own politicians will be traveling to outside the country to get healthcare. So if we invest in our healthcare, I think it's something good for we Ghanaians.
I think it's really important for the government to invest in the healthcare system for the ordinary Ghanaian, because healthcare is so crucial. And as Ghanaians, if you don't have a healthy nation, you can't have a working country. So the government's efforts at ensuring that each district has a hospital or has a working clinic will help the citizens in those areas, to thrive and to prosper.
I have visited UGMC. It's top notch, honestly, from my experience, and some of my family members who have attended or have gone there for healthcare services. It's really been good so far. I don't have anything to complain about, because when it comes to the infrastructure, everything is there. There are doctors there too, and then the maintenance, every time, the place is being well kept.
I've been to Accra Regional Hospital, Rich, and I've been there myself. When I'm ill, I reach there. I've been there myself. It's okay. Everything is all right, and I think the standard too is okay. But the only problem is the workers there. I think just 2 days we saw the minister himself visiting some of the hospitals, unexpected, and he saw what is going on. So I think the government have to capitalize on that and have good talk with the health workers, so that they can relate to we the citizens, so that everything will be okay for us.
So I just want to thank President John Mahama for the good work, for the Ridge Hospital, Bank of Ghana, for all the good things that he's been doing. We say when I came here, my mom is very comfortable, she hasn't complained, and me myself, I've seen the good work. So I just want to plead, we should build more and more, so that when we come, that the ones that are from the village, when they come, they can also feel more comfortable, and they say more good things about how we are saying about him. We all want to say thank you for everything that he has done.
Your Excellency, Dramani Mahama, I think that the healthcare infrastructure you've made so far is really helping a lot, and I would entreat you, with all due respect, to do more, because the population is, increasing day by day, and there are more people who need healthcare around and they are not getting. So the fact that you are even thinking about that is really a good thing, and we thank you very much as Ghanaians.
Well, Mr. President, my message to you is to ensure that, one, Ghanaians are eating healthy. Not only that, but to ensure that our hospitals are well equipped with the right equipment and tools that will support the healthcare system, that the nurses and doctors are also well equipped and well paid as well. This is really important for our healthcare system.
Great expectations from the streets of Ghana. We've heard from the citizens. Now let's hear from the man himself. Let's rise and welcome our host and special guest, His Excellency, the President of the Republic of Ghana, John Dramani Mahama. Please put your hands together.
Thank you very much. Kindly resume your seats. A few months ago, I had one of the rare weekends when I didn't have a social engagement. And so I decided to take it easy at home. And then I got a call. He says, President Obasanjo is coming to see you. I said, Baba, you won't let me rest small. And so he arrived with a big retinue of people. And it had President Obasanjo, our friend Mark Daibo, Michelle Sidibe, Edem Aziogonu, and Archbishop Duncan Williams. Now this had happened just after the events in America where the USAID office was shut down, and America announced a suspension of USAID programs. And so even though the issue of health sovereignty and domestic financing of our health systems had been an issue of discussion for several years, that event made it even more urgent. And so Baba had dragged all these people with him and said, we need to hold a conference and put some more urgency into creating resilient, self-sustaining, and self-reliant health systems. And so that is how come the idea of this summit was born. And so President Obasanjo, Archbishop Duncan Williams, Michelle Sidibe, Mike Daibo, Edem Aziogonu, and all of you who gave birth to this idea, I want to thank you. It's because of you we're here today. I want to thank the DG of the World Party, all the men, thank you. In the holding room, I was discussing with Director General Tedros, and I was talking about President Ruto having invited us to come and understudy their primary health care system. And it turned out that the technical assistance for setting up that system came from the World Health Organization. And so immediately, Director General Tedros offered. And so we'll expect your technical team to come and work with us to design our own primary health care system. I believe that this would help with preventive health system and create a more resilient health system for us. So I want to thank you, all of you who have taken time, Victor Bampo, Nanoye Bampo, and all of you who have made this possible. I want to thank all of you and all those who have traveled from near and far to join us. Thank you very much. So without wasting any more time, Your Excellencies, let me begin by offering you a heartfelt akwaba, and that is a warm welcome to Ghana, the land of freedom and justice, and the proud home of Pan-African aspirations. We're not gathered here today by chance. We're here by conviction, shared purpose, and a collective refusal to accept the limits imposed on us by an outdated global health order. We're here because we choose to lead reform, to heal, and reimagine what our healthcare systems can be. This summit comes at a time of overlapping and intensifying global crises. We have wars, we have pandemics, we have climate shocks, we have economic volatility and widening inequalities. And these are not just testing our systems, indeed they are exposing where the fault lines are. The world has changed, but global health governance has not kept pace with the changing world. At this moment, we're called to redesign the architecture that has for far too long excluded Africa's voices, excluded Africa's needs and innovations. We're called to build systems that do more than respond to crisis. We must build systems that generate resilience, produce equity, and amplify dignity of our people. Let me be clear. We've seen profound global health achievements over the past decades. That is true. And let us honor those successes. For instance, child mortality has been halved since the 1990s. Maternal deaths have dropped by over 40% since the year 2000. Over 29 million people now have access to life-saving antiretroviral treatments. Millions are living longer and healthier lives due to cleaner air, better sanitation, and innovative health systems. These gains have not been by accident. They've been the fruits of bold partnerships like Gavi, the Alliance for Vaccination, the Global Fund, PEPFAR, unfortunately, that's part of the program that has been cancelled under USAID, and many others. But even as we celebrate, we must confront the truth. These gains are now under siege. In 2023, global development assistance declined sharply, and Africa felt the shock. Immediately, maternal health programs halted, vaccine supplies delayed, and medicines disappeared from the clinical shelves. In Ghana, our community-based health delivery model, which we call the CHIPS compound programs, was brought to its knees by abrupt funding withdrawals. The ripple effects were felt all across our country, from Dodowa to Damango. This is not merely a funding gap, it is a crisis of imagination, a vacuum of solidarity, and a deep failure of shared responsibility. Above all, it is a question of the sovereignty, the right of African nations to determine their health priorities, marshal their capacities, and lead with their own vision. And so out of adversity comes opportunity. Africa must no longer be the patient. It must be the driver. It must be the author. It must be the architect and the advocate of its own health destiny. Let us remember that Africa is not new to global health leadership. When HIV and AIDS ravaged our continent, African leaders like President Olusegun Obasanjo and the late Kofi Annan of blessed memory helped catalyze global responses that birthed the Global Fund and Gavi. When Ebola struck West Africa, President Ellen Johnson Sirleaf and her colleagues became a moral compass for the conscience of the continent. During COVID-19, President Cyril Ramaphosa rallied the African Union into collective action on vaccine access. Today, President William Ruto is leading the charge to eliminate malaria as a continental scourge. Today, President Kagame is the African champion on domestic health financing and is leading advocacy in building resilient, self-reliant African health systems. We've built enduring institutions like CDC, Panabios, the African Medicine Agency, that are not merely bureaucracies. These are symbols of an emerging African health ecosystem that is rooted in digital innovation, it is grounded in data, and designed for self-determination by African countries. Your Excellencies, ladies and gentlemen, here in Ghana, we have not stood still. We have uncapped our National Health Insurance Scheme financing, opening a fiscal space of about 3.5 billion cedis more for broader and deeper health coverage. We've launched the Ghana Medical Trust Fund, otherwise called Mahama Cares, a sovereign innovation mobilizing public, private, and philanthropic capital to tackle chronic disease burdens like hypertension, diabetes, and kidney failure. Our launch of our primary health care program in the coming months, along with the recruitment of community health volunteers, will improve the general health and wellness of our citizens, marking a significant step forward in preventive care. And that is where DG Tedros has promised to help us. But let me share one real-life story. And this is of Akosia, a young mother in a town just not too far from Accra, called Dodowa. She survived childbirth complications because the CHIPS compound she attends was digitally linked to a regional hospital. And so in real time, she had a real-time referral system that saved her life in childbirth despite the complication. A digital prescription platform ensured that she received the medicines that she needed without delay. This is not a vision of the future. It is present reality of health sovereignty in Ghana. We're not merely reacting to emergencies, we're building systems that create jobs, reduce inequalities, and uphold the dignity of every Ghanaian, no matter where they are. Health is wealth, and we must reframe the economics of well-being. We must reject the outdated notion that health drains our economies. In truth, health is the engine of productivity and bedrock of inclusive growth. The WHO has shown that for every $1 invested in health resilience, it yields up to $4 in returns. This return is even greater in Africa, where youthful populations represent latent economic dynamism. And so every malaria case that is prevented is a day of work that you have regained. Every maternal death that is avoided is a family that continues to remain stable. Every vaccinated child is a future you have secured for your nation. We must therefore urge our ministers of finance, and I'm sad our Minister of Finance is not here, to treat health as a capital investment, to encourage sovereign wealth funds to allocate resources to biotech, to diagnostics, and resilient infrastructure, to call on economists to revise national accounts to reflect health as productivity multiplier and not a consumption expense. And so I suggest that we act decisively at 3 levels. And the first one is that globally we must champion a new health governance architecture that reflects a multipolar, digitally interconnected, climate-challenged world. Health governance must be democratic, it must be just, and it must be fit for the 21st century realities. The second one is that regionally Africa must scale up its homegrown solutions. The Africa CDC, the African Medicine Agency, the African Continental Free Trade Area Health Corridors, and the AUDA NEPAD Resilience Agenda. These are all things that we need to scale up. And then nationally, we must execute not merely plans. This requires political will, domestic resource mobilization, and as DG Tedros said, effective leadership. So success is going to depend on our scaling innovations like PanaBios for digital health verification and pandemic preparedness, Proper for transparent medical supply chains, and BioNovac to transform vaccine production from molecules to the market. And what are the new commitments? Today I'm pleased to announce 2 significant commitments. The first is the Presidential High-Level Task Force on Global Health Governance. This will be a convening platform to engage global and continental partners to redesign the health governance systems for the world we live in now, not the world of yesterday. The second will be the launch of the Sustain Initiative, and this means scaling up sovereign transitions and institutional networks. This is a bold African-led platform that will align our national budgets with our health priorities, will mobilize sovereign, diaspora, and philanthropic capital into our health systems. It will foster cross-border learning, innovation, and accountability. And I extend an open invitation to all nations represented here to join us in building an African health investment ecosystem that is driven by purpose and is powered by equity and anchored in our sovereignty. And so, to conclude, the Accra Declaration for Health Sovereignty that we are discussing in this summit is more than a policy forum. It is a moral call to action. It is a strategic milestone and a continent-wide awakening. And I wish to thank all those who have stood with us in this journey: the Afro Champions, the African Union, the Rockefeller Foundation, the Georgetown University, the Obasanjo Foundation. Your partnership reflects the new multilateralism the world needs, grounded in co-creation, not extraction, and based on mutual respect for each other.